Many of you enjoy having your meal from just about anywhere. It could be at your home, in a restaurant, or even at a friend's. Some of you, however, end up having upset stomachs or what is most commonly known as food poisoning. But what brings on that? Some people do not know that when you mix different foods on a plate, especially the cooked and the uncooked, bacteria can pass over from the raw food to the cooked food.
We have regularly outbreaks of foodborne illnesses, which are just caused by this non-separation, segregation of raw from cooked.
Dr. Jean Kamanzi, the FAO Regional Food Safety and Quality Officer for Africa, says that most foodborne disease outbreaks occur in homes during meal preparation.
Usually, we call them self-limiting, so the organism will react. So you are going to stay home. Sometimes you don't even go to see a physician. You are very just uncomfortable. You have diarrhea. After 2 or 3 days, the organism will recuperate and you are okay.
There are numerous foodborne diseases.
Typhoid is a foodborne disease. You're all aware about. You're aware about the tapeworms that we get from the various beefs, pork.
Dr. Jenna Cheng, the Director General of Health Services in the Ministry of Health, says the country is grappling with this silent killer.
We have had numerous people dying from typhoid.
For young children, it's deadly because the immune system is weak.
Unsafe food containing harmful bacteria, viruses, parasites or chemical substances causes more than 200 diseases. And the World Health Organization statistics show that about 2 million people die annually from foodborne and waterborne diarrheal diseases. The symptoms to watch out for include fever, headache, nausea, vomiting, abdominal pain, and diarrhea. Some of the bacteria include salmonella in eggs, poultry, and other products of animal origin.
If you eat that meat, which is contaminated by fecal materia of the animal, we have a lot of microbial pathogens there, which will render people sick.
With the Campylobacter, another type of bacteria, the main causes are raw milk, raw undercooked poultry, and drinking water, whereas with Escherichia coli, commonly abbreviated as E. coli, is unpasteurized milk, undercooked meat, and fresh fruits and vegetables. Listeria, another serious bacteria, can lead to unplanned abortions in pregnant women or even death of newborns. It is most common in unpasteurized dairy products and various ready-to-eat foods, and it can grow at refrigeration temperatures. Apart from bacteria, there exist viruses like hepatitis, parasites, some of which pass through soil, and prions responsible for the deadly mad cow disease. Dr. Kamanzi asserts that in as much as this may be avoided from meals prepared at home, the problem is now prevalent as a result of growing catering business.
If I swab your hands, I'll find some microbes which call Staphylococcus, for example, aureus. So these, in high numbers, will produce toxins, which will end up in a finished product.
The evolving habits where people, especially the working classes, turn to processed foods has worsened the situation.
Like one food, which if it's traded, for example, largely within the country, you can get an outbreak.
Another area of concern is pesticides.
You spray pesticide your apples and you don't respect the withdrawal time. People eating those apples may end up eating the residue of which are on apple.
He says the consumption of these residues can kill someone over a period of time.
It will take 5 years if you are exposed to it, you eat it regularly, and after 5-6 years you develop a cancer.
Unfortunately, in most developing countries, it's not easy to tell the linkages. Despite this, Dr. Cheng says there are measures to ensure safety.
Uganda has a national codex committee that addresses the issue of food hygiene, food safety, and of course leading to fair trade.
Codex committees exist in different parts of the continent, and in a just concluded FAO's second Pan-African Codex Capacity Building workshop in Uganda, concerns on food hygiene were adequately addressed.
Even when food is being planted, we want to make sure that it is done in a way that it is safe for human consumption.
If food safety is taken lightly as a result of globalized trade, local incidents could spawn global emergencies like China's melamine infant formula crisis in 2008, which affected about 300,000 infants, killing 6 in China, and the E. coli outbreak in Germany in 2011, which led to 53 deaths. Florence Naluyimba, NTV.